Hello, beautiful souls, and welcome back to the Medicine Path. I'm so grateful that you're here. If you're new to this channel, my name is Monsho. I'm a registered nurse, licensed massage therapist, Reiki master, and shamanic practitioner, trained in the Q'ero traditions of Peru through the Four Winds Society. Here on the Medicine Path, we explore the place where modern science, ancient wisdom, and compassionate healing come together. Today's question is one I've been asked many times. When should I use medication and when should I choose holistic medicine? My answer may surprise you. I don't believe we always have to choose one or the other. In many situations, they can work beautifully together. As a nurse, I've witnessed medication save lives. I've cared for people whose infections improved because of antibiotics. I have seen medications help stabilize blood pressure, control blood sugar, reduce seizures, improve mental health symptoms, relieve pain, and support people through life-threatening illnesses. Modern medicine is extraordinary, and I have tremendous respect for physicians, nurses, pharmacists, therapists, and healthcare professionals who devote their lives to caring for others. But I've also learned something else. Health is more than the absence of disease. Many people continue to struggle with stress, poor sleep, chronic tension, emotional pain, anxiety, grief, or a feeling of being disconnected, even when their medical condition is being treated. That's where holistic care can often provide meaningful support. Holistic care may include healthy nutrition, regular movement, meditation, breath work, massage therapy, time in nature, spiritual practices, and for many people, acupuncture. Acupuncture has been practiced for thousands of years and is used around the world. Research suggests it may help some people manage certain types of chronic pain, nausea, and other symptoms. And many people reportedly feel deeply relaxed after treatment. While it isn't a cure-all, and it may not be appropriate for everyone, it can be a valuable complement to conventional medical care when provided by a qualified practitioner. Here's an example I often think about. If your house is on fire, you don't sit downstairs and meditate while it's burning. You call the fire department, right? In the same way, if you're experiencing chest pain, difficulty breathing, sudden weakness, or signs of a stroke, severe bleeding, or another medical emergency, you would seek medical attention, right? That's exactly what modern medicine is designed for. But after the emergency has passed, then we can begin asking deeper questions. What contributed to this? What lifestyle changes might help? How can we better care for the body, mind, and spirit moving forward? That's where holistic practices often become part of the healing journey. One of the most important lessons that I've learned is that healthcare should never be a one-size-fits-all. Every person has a unique story, a unique body, and unique challenges with unique goals. That's why it's so important to work with health professionals who truly understand your individual needs. And what I want to say something that's incredibly important. Please never stop or change a prescribed medication without first speaking with the healthcare professional who prescribed it or another qualified member of your healthcare team. Some medications must be reduced gradually, and stopping them suddenly can be very dangerous. So if you're interested in incorporating holistic therapies, or you're wondering whether your treatment plan should change, have that conversation with your healthcare provider. Ideally, work with a healthcare professional who both respects conventional medicine and complementary approaches so that your care can be coordinated safely. For me, healing isn't about choosing sides. It isn't medication versus holistic medicine. It's about asking, what does this person need today? Sometimes the answer is medication. Sometimes the answer is surgery. Sometimes the answer is counseling. Sometimes it's physical therapy. Sometimes it's acupuncture. Sometimes it's massage. Other times it's medication. At another time, it might be spiritual support. And very often, It's a thoughtful combination of these approaches working together to support the whole person. I hope that we continue moving forward with a model of healthcare that honors science while also recognizing the importance of emotional, spiritual, and lifestyle factors in overall well-being. Healing is rarely one thing. Healing is a journey, and each of us deserves compassionate, individualized care along the way. Thank you so much for joining me today. If this conversation spoke to you, I'd love to hear your thoughts in the comments. Have you found that combining conventional medicine with holistic practices has supported your well-being? As always, be kind to yourself, stay curious, and continue walking your own medicine path. Until next time, take good care.